Hi, I'm Mark Olives, and today I'd like to talk to you about physical therapy and happiness. Now don't worry, I'm not going to try and sell you on the fact that physical therapy is going to make you happy. If you go to therapy, your whole life's going to improve. That'd be a little ridiculous. But I'm going to tell you that as a physical therapist, when I see patients, I always keep in mind that this is a complex organism. A human is not a very simplistic little machine. It's very complex. And I always keep in mind that there's a lot of things that go into helping someone heal up. So if I approach a problem with, say, a knee patient, and I look at them and I say, okay, I'm just gonna focus on the knee. But I ignore the fact that they're overweight. The fact is, on knees, every pound of body weight you're carrying is up to 7 pounds of force on the knee. So if we don't address weight loss, I'm kind of missing out on a big component that will help that knee to heal up. Or I might look at it as something that if they're depressed, well, studies show that if you're depressed, your immune system doesn't function as well. If your immune system doesn't function as well, you can't and won't heal up as fast. So there's a lot of different factors that go into helping someone to heal up and to improve. Happiness, or being happy, is one of those components. So just as I said, if you're depressed, your immune system functions worse. If you're happy, studies show your immune system functions better. That helps everything to heal up. Plus, the number one goal of every human on the planet, the number one thing, if you could be granted any wish, is to be happy. So ironically, we don't get taught in society or school or anything the how of being happy, even though that's our most important desired commodity in life. So with that, I want to introduce a series of videos following this that's kind of the how of happiness. So I've done a lot of research on this, and in fact there's a whole field that's emerging in psychology over the past 15, 20 years, and that's positive psychology. So in the past, psychologists used to study what's wrong with people, what's happening with this schizophrenic person, what's happening with this depressed person. But the last 15, 20 years, they decided to say, well, hey, that's all well and good that we're helping look at these problem patients, but how about let's look at the opposite. What is this person doing right that's making them happy? So there's a lot of very interesting findings that show that even though happiness is our most desired commodity, the fact is humans frequently do the exact opposite of what they should in order to be happy. So I like to try and help patients to be happy because it will help with their healing, and it's just good for everybody. Makes me feel good to help people do better, and then they can be happier and live a better life. So I hope that you're able to follow some of the future videos on how to be happy, and I hope they help you out. Thanks.